Good afternoon, Venison Brown. Let's begin the warm-up session. What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education and advanced practice is on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There is also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship, that is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers. How to communicate with patients effectively. To communicate with a patient effectively, you should greet the patient with a smile and their name. This helps to create a positive and respectful first impression and shows that you care about the patient as a person. Take your time, even if you're in a rush. This helps to convey that you are interested and attentive to the patient and that you value their time and input. Try to avoid distractions, interruptions, or multitasking while communicating with the patient. Importantly, explain things as simply as you can. This helps to ensure that the patient understands what you are saying and avoids confusion or misunderstanding. Use plain language, avoid medical jargon or acronyms, and give examples or analogies when possible. Finally, ask your patients if they understand everything to check for comprehension and clarify any doubts or questions. What is the dignity of being a nurse? Being a nurse is a noble and rewarding profession that involves caring for people's health and well-being. One of the dignities of being a nurse is respecting human dignity. Nurses respect the inherent dignity, worth, and uniqueness of every person they encounter, regardless of their health condition, culture, religion, or background. Nurses treat their patients with kindness, compassion, and empathy, and uphold their rights to privacy, autonomy, and quality care. Having a sense of purpose. Nurses have a meaningful and fulfilling career that makes a positive difference in people's lives. These are some of the dignities of being a nurse that make it a rewarding profession. What are the skills I need to be a nurse? To be a nurse, you need a combination of both hard skills and soft skills. Hard skills are those that are learned through training, education, or certification. Soft skills are habits or traits that enable you to work well with others. Hard skills can be acquired through formal education, such as a diploma, associate degree, or bachelor's degree in nursing, and certification or licensure exams. Soft skills include interpersonal and communication skills that are vital for building rapport and trust with patients and colleagues and can be developed through experience, feedback, reflection, and self-improvement. However, depending on the specialty, setting, and role, one may need additional or specific skills to excel in the nursing career. How would you deliver bad news to a patient or their family members? It is a tough but inevitable part of the job, and I believe I have learned to navigate it effectively. I understand how hard it is to watch a loved one feel uncomfortable, so I always try to demonstrate empathy when speaking to patients' family members. I calmly explain the patient's condition and the next steps we need to take, giving them time to process that information and ask as many questions as they need. Even though the news must be upsetting, I knew I needed to be honest about the situation to manage their expectations appropriately. I would never want to give families false hope about the outcome. However, I also emphasized our medical team's commitment to providing him with the best care and treatment options available. You can now start your OET roleplay. Good afternoon, my name is Benison Brown, a community nurse. Am I talking to Mihiraa? Hi, Nurse Brown. Yes, you are. Nice to meet you, Mihiraa. Nice to meet you too. Mihiraa, I am here to check on your progress following your cataract surgery and to make sure that you're following your post-operative care instructions. How have you been feeling overall since the surgery? Thank you for coming, Nurse Brown. I'm okay, I guess. My vision is still a bit blurry. And there's been a slight discomfort, but nothing too painful. I was told it might happen, so I'm trying not to worry. You're absolutely right. Mihiraa, I want to reassure you that what you're feeling right now, mild discomfort and some blurriness in your vision, is very normal after cataract surgery. It's part of the healing process, and most patients experience it for a few days to a couple of weeks. As the eye recovers, things should gradually start to feel better and clearer. However, while these symptoms are expected, it's also important to keep an eye out for signs that may need medical attention. If you ever notice a significant increase in pain, a sudden worsening of your vision, or any unusual discharge from your eye, please contact your doctor immediately. Those could be signs of a complication, and it's always better to get things checked out sooner rather than later. Now, let's go over how you've been managing post-operative care. Have you been able to comply with the post-operative care? Yes, I've been using the eye drops regularly. I have 2 prescriptions, one for antibiotics and the other for inflammation. I've been mostly staying indoors, and when I go out, I wear sunglasses. My eye does get a little itchy sometimes, but I try my best not to rub it. It's really frustrating. Exactly. It's great to hear you've been keeping up with that. Mihiraa, I just want to remind you how important it is to take special care of your eye as it heals. When you go outside, be sure to wear your sunglasses. They're not just for comfort, they help protect your eye from bright light, dust, and potential irritation. It's also really important to avoid dusty or smoky environments as much as possible because those can slow down the healing process or cause complications. At home, please remember not to do any heavy lifting or strenuous activities, like bending over too much or carrying heavy items. These activities can put unnecessary pressure on your healing eye. Taking it easy right now will make a big difference in your recovery. In terms of your medications, I'm really glad you're using your eye drops. It's essential to stick with them as directed, especially the antibiotic and anti-inflammatory drops. Even if your eye starts feeling better, it's crucial to complete the full course to prevent infection and reduce inflammation. And if your eye feels itchy, which can happen while it heals, using artificial tear drops can help soothe that irritation. It's a safe and gentle way to keep your eye comfortable without rubbing or touching it. Okay, I'll try that. I haven't thought about using artificial tears. Apart from these, I've been feeling quite restless at home. I want to go back to my gardening, but I'm not sure if it's safe yet. I hear you. It's natural to feel bored and low on energy when you're used to being active. I completely understand it can be frustrating to wait, especially when you're used to being active. But for now, it's important to be patient and gentle with yourself. You can start easing into light activities like reading, watching TV, or even a bit of gardening, as long as you're careful. Just take it slow, and avoid anything too strenuous. You'll be back to your usual routine soon, and we want to make sure your recovery stays on the right track. Mihiraa, I know recovery can feel slow, but I want to reassure you that things are progressing just as they should. For most people, the recovery after cataract surgery is smooth, with very few complications. It typically takes a few weeks for the eye to fully heal, and during that time, your vision should gradually improve. In fact, cataract surgery has a very high success rate, and many patients end up with much clearer vision than they had before. That's reassuring to hear. I'll try to keep things light. I suppose I just need to be more patient. Exactly. Mihiraa, I also want to remind you about your upcoming follow-up appointment. It's an important part of your recovery, as it gives your doctor the chance to check how well your eye is healing and monitor your vision improvement. During that visit, they'll assess your progress and make sure everything is going smoothly. If any adjustments need to be made to your care plan, they'll discuss that with you then. I know it might feel like a long process, but these follow-ups are essential to ensure that your vision keeps improving and to prevent any potential complications. Do you have any other questions or concerns for me? No, I think you've covered everything. I feel a bit more positive about it all now. Thank you, Nurse Brown. You're very welcome, Mihiraa. I'm glad I could help. If anything else comes up or if you notice any concerning symptoms, don't hesitate to reach out.